Hassan.
Well, thank you, Mr. Chair and Ranking Member Murray. Thank you to the panelists and to your entire teams. You all have been working tirelessly, and we know that, and we are very, very grateful. I wanted to start to get at the issue, Dr. Schuchat, with you of diagnostic testing capacity. I know the administration's ordered an independent review of the CDC lab about problems that arose in the manufacturing of the diagnostic tests kit. What is clear at this point is that the domestic testing capacity has been significantly lower here in the United States than what we've seen in countries like South Korea and Italy. So, Doctor, are you confident that the policies put in place by CDC and FDA over the past few days will allow states to test for coronavirus at a level commensurate with what this rapidly evolving outbreak requires?
I am optimistic, but I want to remain humble because we see in emerging infectious diseases surprises.
Right, and one of the things that we're dealing with right now, so for instance, my state, which had its first confirmed case yesterday, has a dwindling number of kits, and they tell me they have to do 2 tests per patient, because if you get a negative, then you're going to retest the next day. And we're still having to send tests into CDC for confirmation, even when we do them at the state level. So when do you expect to reach a point where CDC will no longer have to perform confirmatory testing on samples from state labs?
Yeah, that should be very soon, state by state, as they verify their procedures, and we've worked closely with FDA to expedite that.
Okay, and has a lack of federal resources or personnel within CDC played a role in what appears to have been a lack of ability to scale response efforts in order to meet the demand for diagnostic testing across the country?
Not to my knowledge.
Okay. To Dr. Fauci and Dr. Kadlec, I'm concerned that the delays in making test kits widely available means we don't yet have a full sense of the scope of the problem. I mean, if we can't test everybody who has these symptoms yet, we may not know what the full scope is. And having an accurate accounting of the problem we face is critical for your ongoing preparedness and response efforts. So Dr. Fauci and then Dr. Kadlec, how has our limited diagnostic testing capacity impacted your response efforts, and what steps are you taking to mitigate those challenges?
That's actually not something that I'm involved with, but I'd be happy to give you an opinion of that.
Sure.
I mean, obviously, you would want to be able to have as many tests as you have, as you need,
right,
to be able to do, and that's what the CDC right now is ramping up in collaboration with the state and local health departments. The first level is to get individuals in multiple states. They started off with 6, and it'll probably be more if I'm not mistaken, to be able to test people who come in with symptoms that would be suggestive of a respiratory illness, either flu or coronavirus, and if they don't have flu, to determine if, in fact, it is coronavirus. As we improve and get better and better at that capacity, we'll have a much more accurate assessment of what is going on in the community.
Thank you. And Dr. Kadlec, briefly?
Yes, ma'am. I think the thing is 2 elements there. One is a trigger in terms of action. How do you respond in early warning? And I think one of the things that CDC has been doing, and I'll let Dr. Schuchat comment on this, is using its influenza-like illness network and the tests that they do there to be able to test broadly to see surveillance. So there's a trigger to respond, and then there's the more important one, I think, in terms of understanding what's circulating, which is really seroprevalence of this virus in terms of being able to detect antibodies in people's blood broadly to understand what's the denominator of people who may be asymptomatic.
Okay.
And so both of those have a significant importance. For our part, with BARDA, we've basically been funding commercial laboratories and basically trying to develop point-of-care diagnostics to advance that. Dr. Schuchat?
Yeah, just
quickly, because I have another question to get to. So,
yeah, we're doing that community surveillance in the 6 cities and hope to expand it broader so we see what the tip of the iceberg, what the bottom of the iceberg really is.
Thank you. I wanted to turn to Commissioner Hahn for just a moment. The FDA has such an important and wide-ranging role to play in our ongoing response efforts. As you know, your announcement last week regarding an unnamed drug shortage that was attributed to disruptions in China due to the coronavirus caused some confusion among public health experts. And just now you said you couldn't name it, and for those of us who either ourselves or have loved ones who have multiple medications, the notion that there's a shortage but we don't know if it's ours is a really difficult thing for the public and for people who depend on pharmaceuticals. Yesterday, you stated that the U.S. labs could perform up to 1 million tests this week, while public health experts have said that they hope to see U.S. labs complete 10,000 tests per day. And tests take time, and they take staff. So I understand it's fast-moving, but it does seem to me like FDA's messaging has been confusing and at times contradictory over the past few days. I am over time, so I actually won't ask you to respond right now, but I would urge you, and perhaps we can have this conversation offline, to get a process in place so that you are making sure that your communications are clear to the public and that and that they're integrated. And I'd look forward to having that conversation with you at a little bit later. Thank you, Mr. Chair.
Thank you, Senator.